Thanks everyone for joining us today for this webinar on behalf of the National Genetics Education and Family Support Center, as well as the Heartland Regional Genetics Network. We wanted to thank everyone for taking their time to join us today. I did want to highlight on this slide just really quickly the disclaimer that this presentation was funded by Health Resources and Services Administration, HRSA, as part of the National Genetics Education and Family Support Center project. And before we get started, I just wanted to run through a couple housekeeping items really quickly. Just to note that this webinar is scheduled to last 1 hour, including time for question and answers at the end. All dial-in participants are going to be muted to enable that the speakers can present without interruption. The webinar is being recorded and will be sent via email along with the slides, the reference guide that we'll be discussing today, and a brief evaluation survey after the live presentation. So keep an eye out for that. Also, I wanted to note that questions can be submitted via the chat function at any time during this presentation, and we will have some dedicated time to answer questions at the end of the presentation. Just to give a quick review of the agenda, we're going to run through an overview of the National Genetics Education and Family Support Center, or Family Center, provide an overview of the reference guide and some of the resources that are linked and available throughout the reference guide, and I'll talk a little bit more about that momentarily. We'll have the Heartland Regional Genetics Network discuss their community access program and really share some of the experiences that they had in running that program, and then have a little bit of time to talk about some key takeaways from both the reference guide and the work that Heartland did. And we'll also then have some time for Q&A at the end. So the National Genetics Education and Family Support Center is currently made up of organizations that are already working to support patients and families, such as Family Voices, Parent to Parent USA, and Genetic Alliance. This is a 3-year project, began in 2017 and is funded through May 2020. Our key functions really are to help families develop skills to partner with professionals and improve systems of care, to assist the regional genetics networks in partnering with families and family-led organizations, to assist with outreach to diverse and medically underserved families and communities, and also to provide education and support. And some of the ways that we do this really are through providing trainings, providing technical assistance to the regions, maintaining and promoting online resources such as diseaseinfosearch.org, genesandlife.org, and Advocacy Atlas, which is available on the Genetic Alliance website. And also supporting partnerships between family-led organizations, the National Coordinating Center, the Regional Genetics Networks, and the Family Center. So we're really trying to make sure that everyone's working together and sharing information so that really the value is provided to families that we bring across all of the different regions and projects. And the Family Center, I wanted to note, is under our Expecting Health umbrella, and born from Genetic Alliance, Expecting Health really has a rich history of bringing parents, families, and other stakeholders to the table to inform and lead quality projects. We empower people to make the right choices for themselves and their families by using clear, accessible, and accurate information. And you'll see here some of our key programs in addition to the National Genetics Education and Family Support Center. We've got Baby's First Test, the Newborn Screening Family Education Program, and the Perinatal Nutrition Collaborative as well. Now this next section, I really wanted just to take some time to highlight the new resource that was developed by Heartland and the Family Center to support needs assessments and community partnerships. Here's a quick look at the cover page of the resource that we're going to be talking about today. The resource is available through multiple places, including the National Coordinating Center for the Regional Genetics Network's Resource Repository, or RERE as they call it. We will also make sure that the link to the guide is circulated along with the recording of the webinar presentation. So, Family Center and Heartland Regional Genetics Network really work together to develop this resource to provide the regional genetics networks with information, case studies, and tools for conducting needs assessments and forming community partnerships to improve underserved populations' access to genetic services. The Heartland Community Access Project was used as a guiding case study to provide insights on what did and didn't work when partnering with underserved Hispanic and Marshallese communities. You can find more information not only today, a little bit later in the presentation, but also on Heartland Regional Genetics Network website. The tool was really designed to increase the capacity of the regions to better work with underserved communities by sharing resources and best practices on obtaining accurate population estimates, considering economic, logistical, and sociocultural barriers, forming trustworthy relationships with communities, and using existing community resources to minimize the strain on these regional genetics networks. And I'll also just say that while this guide was made with genetic services in mind, the lessons and resources are certainly applicable for the broader healthcare and advocacy community. So I did want to mention that. Now, just to highlight a few ways that we think this resource will help in terms of the information and resources provided in it, we really think it'll support efforts to identify underserved populations and the barriers preventing them from receiving care, particularly genetic care in this case, to help you avoid practices that are previously proven to be ineffective in other regions or projects. It can help understand the concepts of what a needs assessment is, what community partnerships are, why they're important, and really what resources are available to support these activities. It can also help you pinpoint existing strengths within your network, organization, or project while learning about additional strategies and available tools. Now, I'm going to run through just some key takeaways, which I'll dive deeper in some of the slides following this. And this is just a really high-level overview of some of the topics and lessons covered in this document in terms of just the key takeaways. So just a reminder to build collaborations, to build relationships with community members. The really big lesson here is don't recreate the wheel, identify and utilize existing resources and strengths. And so we try to do that by providing a number of resources and materials, organizations, and things that can support your efforts throughout the resource. Also, the Family Center and Heartland are both available as a resource. And we have our contact information at the end in case you want to ask us any questions or discuss strategy or anything like that for your projects. Obtaining accurate population estimates for underserved communities is really important. And so we'll talk a little bit about how we can, how this guide can support that. Minimize economic, logistic, and sociocultural barriers to care. And really important here, track program effectiveness and understand your target community. So really looking at that evaluation, quality improvement aspect of these things as well. So in terms of building community partnerships, we really wanted to highlight some things that will help ensure success when partnering with communities and also conducting needs assessments. So just some things to keep in mind before we start to look at some of those individual tools that are located in the guide. So when building collaborations, working with organizations who understand and support a community is really critical to building trust and ensuring sustainable impact. Just kind of knowing that members of those communities are often the experts in their experiences. And so being open to learn from those communities about the issues that impact them. The guide contains tips for working with community-based and family-led organizations, as well as resources to support the formation of hospital community partnerships, which will allow you to gain access to valuable community health needs assessments and other community data. It's also really important to have a strategy for engaging community members, participating in community events, and incorporating leaders into your program. And really just wanted to highlight that rather than just kind of a random approach, it's really important to have a plan, and particularly working with members of the community or a member of the community to put together that plan can really prove to be useful. And Heartland's going to talk a little bit about that process in working with their Hispanic and Marshallese communities in their region. This guide provides resources to really help you identify minority leaders and improve contact with those leaders, as well as other local and community organizations, to provide you with that first step to building those strategies alongside the communities that you're trying to reach and impact the most. So when conducting needs assessments, one of the lessons that we wanted to really point out here is to not recreate the wheel. There are a lot of resources and organizations, services that are already available, kind of learning on the lessons that have already been learned from other organizations and groups that have done this before. So you should really use the resources that already exist to support increased project or network participation and ensure that your funding is being used to maximize impact. And the guide has a number of helpful tools and resources, as well as communication strategies to promote collaboration within as well as across organizations. It's also really important to obtain accurate population estimates for underserved communities, especially if you're going to be applying for grant funding or assessing a need for medical services. It's important to have those accurate, up-to-date numbers for those things when you do that. And this guide does have a detailed population estimate methodologies, as well as a population health mapper with some estimates. And I'll be showing a screenshot of that tool and talking a little bit more about that here in a second. So tailoring community interventions. A couple things really just to keep in mind here. You want to minimize economic, logistic, and sociocultural barriers to care. That's really important. And so we have some tips and best practices around that specifically inside the guide. One that we've noted here is really improving your nonverbal and verbal communication with community members by understanding the nuances of factors like body language, cultural healthcare expectations, as well as translation services. And this guide does have resources as well for educating community members as well as healthcare professionals about those barriers that exist, how to identify them, and then ways that you can try to minimize those barriers. And again, going back to the effectiveness and kind of from an evaluation aspect, you want to track your program effectiveness and understand your target community. So effective use of data, family stories, community feedback, those kinds of things will really help you ensure that your program meets the needs of communities of different backgrounds, knowing that different communities often will have different needs, different barriers, different challenges. And so really looking at the data that you collect from those communities, from conversations, from the stories that you get from the families you're working with, will help you understand what those different challenges and also how effective your efforts have been with different communities. This guide also has resources such as a fake profile generator, which will help you realistically test program effectiveness and consider how an individual with certain provided demographics would be able to access or not access genetic services, as an example. Now, for this guide in particular, we really wanted to ensure that we were building on the strategies, successes, things that we were seeing across the regional genetics networks when it comes to conducting needs assessments and also partnering with diverse communities. So regions have developed and utilized their own methods for providing genetic services for underserved populations. A couple of the things that we've seen are creating materials in multiple languages, building relationships with different communities, whether it be with leaders in the community or organizations that work with specific communities, and also engaging with faith-based organizations. And again, Heartland's going to talk a little bit about their strategy there. It's been really interesting to see some of the regions find success with these different techniques. The tool does have supplemental strategies, resources, and explanations that the networks or organizations will be able to learn from, adapt, and hopefully apply to build upon existing methodologies. And underserved populations can't really be approached the same way as other populations. So pulling in expertise from different resources provided in this tool can really help you increase your program effectiveness. So next, we're going to talk about some tools and resources that are highlighted within the guide. The sampling of resources that I'll be showing today are hyperlinked in the guide. And so if you click on them within the reference guide, they'll take you straight to the tools. You'll find lots of resources in addition to the ones that I'll be showing today, but we really wanted to provide just a sampling of some of the resources from both the needs assessment section of the guide as well as the community partnership section. And the following slides are going to have screenshots and just some brief descriptions of some of the resources available within the guide. I do encourage you to take a look at the guide when you receive the link and take a look at the other resources that are available throughout. So the first one here is Project Implicit. So it's really important for providers to avoid categorizing or assuming healthcare expectations based on culture, as healthcare expectations are likely to differ on a patient-by-patient basis. This tool from Project Implicit provides help for organizations and researchers to identify existing biases. You can really use this tool to find out implicit associations about exercise, anxiety, alcohol, eating, and other topics that you or colleagues may have. And I encourage you to go in there and sign up, and it's a quick test that you can take to really take a look at some associations that you may be making implicitly that you don't even realize. So I mentioned this a little bit ago, but online databases with pre-existing population estimates are there for easier access to reliable population estimates. Health Landscape offers a population health mapper that displays factors pertaining to mortality, morbidity, access to and quality of healthcare, health behaviors, demographics, social environment, and physical environment across a county or a state. And this Health Landscape tool gathers information from portals that obtain their data from population studies. So this can really help increase the accuracy of population estimates in relation to census or survey data. So this toolkit is really based on the lessons learned from the national and community partners that were involved in the Genetics Education Needs Evaluation Project, or the GENE Project. The GENE Project was a 5-year program funded by the Health Resources and Services Administration, HRSA, to investigate the genetics education needs of underserved minority communities. Some of the lessons that are included in this guide include how to approach and involve community members and how to formalize and maintain a community-based participatory partnership. Another resource that we've provided within this document are culture clues, which are printable tip sheets for clinicians. They're designed to increase awareness about concepts and preferences of patients from the diverse cultures served by the University of Washington Medical Center. You can see there's a few listed here. I encourage you to go to this webpage. You can click through to the different sheets that are printable so that you can download those, print them, and have them on hand for you for all of these different diverse, unique cultures that they have listed here. Now, this toolkit for partnership, collaboration, and action provides information and resources to support building strategic partnerships, utilizing effective outreach strategies, and crafting clear communications. And as you can see, this was prepared by John Snow Inc. Again, this is available in the, along with the other things that I've just shown you, available in the reference guide. Everything is hyperlinked so that you can see the name of the resource, click on that, and go right into the resource from the reference guide. We also have a list of resources at the very end of the guide for you to go through and look at those individually. And now I'm going to be passing things off to the Heartland team, and Mary Ann is going to talk first about some of the experiences and techniques that they had in engaging the Hispanic community throughout the Heartland region.
That allows us to collect and disseminate information more in a systemic way. But most importantly, it allowed us to hear the stories of the families in the context that they were most familiar with, where they were most comfortable. So our first step was to ask the community. We formed partnerships and collaborations with the Hispanic leaders of the family support networks, the health professionals that serve Hispanics, and many, many others. Next slide, please. Next, yes, thank you. So we started really with a blank slate, trying to put aside our own knowledge or assumptions about the community and receive direction from them. We learned and planned the research project with the community. We designed a list of open-ended questions that allowed the families to share their own stories. We interviewed the families, we wrote the transcripts, and we analyzed the transcripts, all in Spanish. Next slide, please. What we humbly learned during this process was the importance of flexibility and adaptability. We interviewed 26 families with children with genetic conditions in 3 states. We met the families where they were most comfortable, in their homes, in local libraries, daycares for special needs, or family support facilities. We met with them at any time of the day or night, in any situation. It was not unusual to conduct an interview while the family was eating supper or bathing their kids or taking care of their child's medical needs. Many times my colleague Anna and I, who did the interviews together, would take turns in addressing the active children while one of us finished the interview. We learned to modify our questions according to their needs. For example, if we asked about cultural barriers, like what were the cultural barriers in accessing genetic services, many families would not understand that question. We think they would, but they didn't. So we'd modify and ask, what are the differences between living in the USA compared to Mexico? Or what are the differences between the 2 healthcare systems? We learned to accept the differences also between how I was treated or how Anna was treated, or how they welcomed Anna and me. Anna, who is a young Mexican woman, was automatically welcomed by the young mothers and would connect with her immediately, while the fathers preferred to address me. So we were flexible on how we would conduct our interviews. And that was very, very important to get the information that they truly wanted to share with us. We basically adapted to their needs of each of the families, including those that dismissed us. Although both Anna and I are bilingual Hispanics from Mexico and from Peru, and there's a lot of commonality in our cultures, We each come from different experiences, different stories, and that is just as true for the families we interview. So as we progressed in the interviews and reviewed the transcripts, we were keenly aware of putting aside our own biases, our own assumptions, our own personal histories, which is actually the nature of qualitative research. It was not about our agenda, our own experiences, but about the agenda and experiences of the family. Next slide, please. So we did identify the barriers, actually about 7 barriers, or the factors that influences access to genetic care. And some of these barriers we kind of expected, but many we did not expect. And one was the expectations of medical care. We learned on how culture and experience in systems of medical care in 2 countries influence what is expected of the American healthcare system, including genetic services. But after we identified all these barriers, which were 7, the question was, what do we do with that? Next slide, please. So we went back to the community. We went back to our collaborations. We went back to our relationships. We formed the Hispanic Access Advisory Committee of families, home health visitors, and genetic service providers. And one thing that we truly learned in our interviews was the importance of home healthcare providers and the trusting relationships and bonds that were formed between them and the families. So we made sure to invite home healthcare providers to our committee. So what we did with the committee again was to ask them to review these barriers and provide us with recommendations on how we can best serve this community in accessing genetic services. Next slide, please. These recommendations were provided, which include training of interpreters and home visitors, information, written and video information, and also educating genetic providers. We're currently working on the production of a video describing genetic services only in Spanish that is code-free friendly. One of the strongest barriers that we identify was the lack of knowledge of what genetic services are and the fear of having a genetic condition. We hope that this will describe genetic services in the context and the culture that the families understand. Next slide. But our story continues beginning with the interviews that Ana and I did, into our attendance with a genetic counseling student last year of the Hispanic Women's Organization of Arkansas. So our relationship, our bonds with the community always continues, those that we've established starting 5 or 6 years ago. Next slide, please. So it is very important to look back on how this project started, maybe in 2014, 2015. It was through the vision of Heartland to work at the grassroots level with the Hispanic community, to develop relationships, to develop collaboration. Heartland prioritized and funded this project to allow us to truly listen to their stories. But ultimately, it was about the partnership and the relationship with the community leaders and the families that we are most thankful for. Our relationship with this community continues, and we hope that together we'll break down these barriers to access to genetic services. Gracias. Thank you.
Next slide, please, Joel. Thank you very much, Marianne. And so now I'm going to continue with our second story. This is a story about our engagement with a group of people, the Marshallese, who are living in Arkansas, Iowa, and Oklahoma, primarily. For those of you who may not be familiar with the Marshallese people, I do not, unfortunately, have the time today to tell you about their history, but I would encourage you to learn a little bit more about them and about what the US government did to them and their lands, and why many of them originally moved to the United States. Currently, for many reasons, Pacific Islanders are the largest percentage of immigrants in the South Central US. And in Arkansas, we actually have the largest number of Marshallese people off of the islands in the Republic of the Marshall Islands. And so this is a significant population in our Heartland region, and that is certainly one reason why we are engaging with that community. But as I said at the beginning of our storytelling, this also, our engagement came from clinicians describing barriers that they saw and that they encountered when a Marshallese patient came to them. And so I too will share sort of how we have approached this community. It's very similar to what Marianne has shared. We are in a different place right now with this community in terms of our work, but I would say, we've been working together now for a little over 2 years, and I think we're finally hitting our stride. So next slide, please. So there was a woman in this slide, and she's also on this webinar, Linda Riglin, that I'm going to be mentioning. But first, let me give you a little bit of background. So how did we begin? Well, I've already said that there's a very large population of Marshallese in Northwest Arkansas. And because of that, the University of Arkansas for Medical Sciences sought grant funding and was awarded money to develop a Center for Pacific Islander Health. They also recruited a Marshallese physician. They have Marshallese staff. They've trained Marshallese interpreters, and they're just contributing greatly to the community and to trying to address the health needs of the Marshallese. So we reached out to this center to be, as a potential partner, let them know who we were and what we were trying to accomplish. And we had a meeting. And at that meeting, I remember being asked many, many questions about our research project. And I was uncomfortable because our project was not research in the sense, it is in the sense that we're learning, but yes, we want to learn, but an academic project was not what our end goal was, right? Our end goal was to increase access and awareness of genetic services. And again, we need to learn so that we as genetics providers can do our job better when we're serving these patients. And so I remember at that meeting, I had a lot of ideas and questions, but at the end of the day, it's really about, what does the community need? Well, in this particular community, even among healthcare providers within the community, the idea of genetic services, it wasn't foreign, but it's not a medical specialty that's used widely, nor is there a great amount of awareness. And so for a while there, we kind of ran in circles a little bit, because they wanted to know, they being the Center for Pacific Islander Health and our collaborators, well, what are your questions? What are you trying to do, Lori? And I was saying, well, I just want to learn. I need access. I need to be able to learn so that we can then work together. And they then assigned a community liaison. She's a community health worker, a trained medical interpreter, Ms. Linda Riglin, to our project. Now, at the time, Linda, I would say, Linda, you can correct me if I'm wrong, but was not greatly familiar with genetic services. And so we began by doing some education, exposing Linda to our clinics. You know, she actually went to clinics to see what we do and what this is about, and went to prenatal and cancer and pediatrics. And over time, as Linda and I worked together, and as Linda, you know, pushed herself to learn more about this, where we are at now is that Linda is, you see depicted in this slide over on the right-hand side, she is giving the talk about newborn screening to a group of women at one of the local churches. She has translated our materials about genetic services, about newborn screening, about the early hearing detection and intervention program into written materials for the community. She has also written the script for and directed a video about newborn screening for the community that is in its final editing phase and will be available soon. So why Linda? Well, Linda speaks a language. Linda's a member of the community. Linda, you know, Linda's my safe person, okay? So I can say to Linda, here's an idea. Please tell me, you know, if this is way off base, what we need to do, you know, how I need to modify it, or if we shouldn't do it at all. So Linda, in her very quiet, respectful way, will give me that information. And sometimes it is, don't do that, Lori. Other times it's, you know, ways in which to do it. Basically, I do what Linda says, because Linda understands now what we're trying to do, which again is different from any of the other, quote, genetics research projects that have gone on in the community. And we're partners. We have the same goal in mind, which is to educate the community, because we can't, let me give you an example. We cannot go into a community where there are no Marshallese words for genetics per se, or chromosome or DNA, okay? Those terms that we use in English have to be explained in concepts and examples provided, so in Marshallese. And so we have to negotiate and work together to have the end goal of increasing awareness first. As we increase awareness, then we can increase education and literacy around genetics. As we do that, then they become better self-advocates in the clinic. And as I, being non-Marshallese and a genetic counselor, as I learn from the community how they express these terms, what their experiences have been, how they view genetics, how they view medical specialties, how they view, you know, birth defects or conditions that are passed through families, what that's going to do is we can then take that back to the genetics providers so that we can do our job better. And that's what we're trying to do at the end of the day. And so I will close now because I know we have other speakers. So thank you very much, Joel, for the opportunity.
Thank you, Lori and Mary Ann both. I'm going to pass things off to Maria, our next speaker.
Great. Well, hello, everyone. It is great to be here. Thank you so much, Mary Ann and Lori and Joel, for a wonderful presentation on those topics. I'm here really to just talk about the takeaways of what we just heard. And I want to let you know that I've been so fond of this program, of what the Heartland has been doing ever since I became aware of it. They really have been effective. What the idea was for today, which has been going wonderfully, is to tell the story of what they did. Because a lot of times we're asked in the, area of outreach to diverse populations, we're asking, okay, so what are the ways in which we do this? What are the best ways to do outreach? And then we come up with 5 different points, and we come up with a procedure. And then people are like, well, I just followed the procedure, but it didn't work. And so what we wanted today was really to have Marianne and have Lori and Jean and everybody, give them a time to shine so they could show you who they are more than what they did. And so I'm going to highlight that slide, please, in the next few slides to kind of just shine a light on what we love to call, we love to divide the world into hard skills and soft skills. And what Marianne and Lori and all their team has are an incredible set of soft skills that are not soft at all. They're incredibly important, and we need to bring them up to the limelight so that we can do this work. So I'm going to divide the takeaways in 3 simple themes, although they're not exhaustive by any means, because what you heard as you process it, you will realize how complex what they did was. So we're going to talk about cultural liaisons. We're going to talk about organizational agility and flexibility, which is something that Marianne and Lori talked about. And of course, we're going to talk about cultural humility. And as Marianne and Lori mentioned, that is the backdrop of how all this happens. This is a story, and this is how outreach happens, not only in the heartland, but this is how outreach happens anywhere in the world. So, Joel, next slide, please. We're going to talk about cultural liaisons or cultural partners or cultural guides. They used to be called cultural brokers, but it was a war term, so we didn't really want to be too much of that. But what you've observed in Marianne and in Linda, Lori's right-hand person for the Marshallese community, are the perfect examples of cultural liaisons. Why? Because they are partners in helping Lori understand how to bring out information effectively into a community, right? So they're guides in developing materials that will help families to navigate systems. They educate providers. That was another very salient piece in what Lori and Marianne were talking about, is we listened to people. We were not just there to spew information at them in the language that we thought was their language. We listened to them to understand how we could talk to them in terms that would resonate. So we heard Marianne talk about, well, I can't go in and ask, how is your access to the healthcare system? So she changed the question to, I'm going to ask, well, tell me how the healthcare systems in Mexico and the United States differ. How is that happening? So you need to think of ways that only a person who understands both cultures understands how to pose those questions. So as you can see, it's not just a matter of translating a questionnaire. It's a matter of having a very deep understanding of the culture of both of them, so that we know, number one, what information are we after, right? What is the data that we're seeking to get? And how am I going to have an effective way of doing that? Next slide, please. And the other piece, next slide, Joel. Thank you. And this is going to be a bullet by bullet, so you're welcome to just do them all at the same time. Thank you. Thank you very much. So the cultural liaisons work is really a complex job. In this case, and when Marianne, Lori, Jean, and I, Joel, were talking about how this webinar was going to happen and how we were going to make it different, how was it not going to sound like something that, again, we're going to give you a class and we're going to show you how amazing we are because we think it's such a higher level, because we're trying to bring the world together. It's like, no, really, how did this really happen? And so you can see that, for example, they modified the format of what they presented. So they're working on a video of information that probably went out as a tip sheet for people whose first language is English. Well, it turns out that a video or a novella is what works best for a specific culture, so that's what they're going ahead and doing. So they're checking for understanding. They're respecting where they are, meeting them where they are. But Marianne is very special, and I'm going to make you blush here, Marianne, because Marianne has the genetics background, but Marianne is also amazing cultural guide and a cultural liaison, an amazing human who's able to connect on both ends of the culture, of the Latino culture, and the culture where we live in right now. And that doesn't come cheap. And that's where, next slide, please. Next slide, please. That's where we go into organizational agility and flexibility. So Lori noticed that, you know, what Marianne is doing is pretty special. She's not just a geneticist who's sitting there and she speaks Spanish and she happens to know a little bit about the culture and she has some connections within the culture. She's actually going to work and making a specific job of sitting on the phone and talking to people, and then getting out of her office, getting in her car, taking care of children when she goes to visit somebody, because that is how you connect in different cultures. In the Latino culture, we have a saying, which is the face of the saint is the one that makes the miracles, right? Because we are in-person people. And so Lori, organizationally speaking, was astute enough to realize that this was a job, that this was not a volunteer position, and it required a very specific set of skills that Marianne and Linda have, because they were able to do that both ways. So when Lori was thinking about this, she did something that seemed way out there to a lot of people. She dedicated budget to it. That right there is organizational agility and organizational flexibility. The first step, though the most difficult to understand, justify, and feel good about, is dedicating budget to understanding that you need to have someone or several people who are dedicated to accessing communities that are from diverse backgrounds or who are English language learners. So within that agility and flexibility, there are many things that in the organization that have to change, right? The sense of timing. We all know that there are jokes going around all over the world. Every country has them for each region of their countries, but we know that the sense of time is different for different cultures. We know island people, they live on a different sense of timing. The sense of urgency, which I'm thinking that after all this is said and done, all this, lockdown and being at home, we're going to come out of this with a pretty different sense of timing ourselves. There's going to be a cultural shift. But again, sense of timing affects how an organization works, because Marianne and Linda are part of the RGN, who runs in a very tight, specific schedule, but all of a sudden, the populations that they're working with don't run on that. So you have to accommodate for that, or it doesn't happen. Plain and simple. So Lori did it. It happened. Then perceptions. We're talking about humility all along, and our perceptions come into play quite a bit. What is work ethic versus work culture? When we say, oh, those people don't work because their sense of time is so different, people on the islands are just so relaxed, they just don't work. Their sense of time is different, which in turn generates a different work culture. The work is getting done, it's just getting done differently. So when all these things come together and we meet people where they are, we all of a sudden start establishing trust, which is Marianne and Linda's job right there. They're establishing trust between not only among the community that they're helping to link and unite with this, but they're also establishing trust with Lori. Lori trusts Linda. Lori trusts Marianne, that what they're saying is in fact what needs to be done. And Lori did something, I'm going to skip the next bullet, but did something very important, that is relinquishing control. Organizationally speaking, it is something that we're not designed to do in our culture. We're not designed that way. We're hierarchical and we're trying to be more collaborative. That's what we've been working on for the past 10 years or so. But relinquishing control to someone or to a group that we don't fully understand ourselves as the leader of that organization is an incredible act of trust. So trust goes all over, right? It goes into the cultural guide. It goes from the community where you have to work to create that sense of trust, and then it has to come in to play to fulfill the entire circle, the circle of trust, yes. And so all this leads to really understanding what materials, how we present materials, which is what we were talking, and there's my child. How do we present materials? And how do we allow access to all the information? Because we're here, because we're helpers, right? We're good at this. That's why they pay us the big bucks. Not really big, but we feel like they are, because we are helpers. And so sometimes we just need to drop that hat and say, I'm going to try to understand you, which is what they did. Again, budget went into that, into asking questions, into allowing time for Marianne and Linda to say, I can't do my work unless they tell me how to do it. And if I don't have time to interview, to go drive around and see where there's a mosque or where there's a church or where there's that community center that I've never heard about, or simply saying, you know what, there's a WhatsApp group that I want to be a part of. So there's 1,000 different ways that the organization needs to relinquish control and find that trusted person with those important, quote unquote, soft skills. Next, please. Thank you. So again, Lori and Marianne made this point very well. Cultural humility is the most important part. I'm going to ask you to read that in your heads. But it is really meeting people where they are, and truly and honestly, as scientists, I'm not going to say we because I'm a philosopher and there's huge debate about philosophers being scientists, although we define science. But as I laugh by myself in this room, great. But anyway, as scientists, it's much more difficult to come in and say, oh, I don't know a whole lot, right? So teach me. But that's the most important part, so we can have a mutually respectful partnership that will be effective. And next, please. So best practices. I think that Joel, Marianne, and Lori all have talked about this. So this is just going to be said in different words, but what are best practices? And again, this is something that each of your organizations, as you listen to this, will have to go through on your own. And this is a process. This is not by any means a formula that will say, this is how you do it. If you follow this formula, you will be successful. No. And the point of this presentation is to say, you need to work, every organization needs to work on its own version. So the best practices are co-developed in accordance with specific population needs. Joel gave us some incredible resources to find out where those populations are when we don't yet know where they are. Then there's a high level of specific community involvement that ensures a higher likelihood of success. Every single one of the examples that we heard from Marianne and Lori regarding Linda and Marianne's work have at their heart community involvement. It does not happen without community involvement. It cannot, it will never happen. It will never be successful. I'm never sure of anything, but this I'm sure of. That is the most important aspect there. And then developing relationships with specific community leaders and offering them a seat at the table. That is absolutely important. And we've had, I'm Colombian, Marianne is Peruvian, and we've had many conversations about this because, as cultural guides and cultural liaisons, we always get the question in one form or another, that you need to belong to the culture or to the community in order to be able to do the job. The answer is no. But that answer is very nuanced because within that, again, I'm going to bring it back to the skill set that is needed for a cultural guide or a cultural liaison. Within that, you need to have someone who is highly perceptive, highly flexible, and highly effective in communicating to both one culture or the other. The other piece that Marianne and I seem to agree on we agree on a lot of things, but this is one that is, I think, very important that we ask, is it necessary to speak the language? Yes, it's pretty necessary to speak the language because within the language, there are a lot of cultural understandings. And as Lori was talking about, knowing that in the Marshallese language, there is no word for gene or for genetics or for geneticists, it's very important. So if we don't have that knowledge and we don't have that understanding of those concepts that will express the knowledge, we're going to lose out on that relationship. So those are important pieces to keep in mind as we think about best practices, but always at the top of all of this is cultural humility, flexibility, and the ability of an organization or the head of an organization to be able to relinquish control. And I think that is all I have for you.
Excellent. Thank you very much, Maria.
Of course.
So we've got a couple more minutes for questions. I haven't seen anything come through the group chat, but just wanted to remind the audience, if you have any questions, you can send them through the group chat, either privately to me or to everyone. And as just another reminder to folks, we are recording this webinar. We'll provide the recording after the live presentation, along with the slides, the reference guide we've been talking about, contact information for folks that are presenting today, as well as an evaluation that we hope that you'll take. So I'm just going to give us a couple moments here to see if any questions come through before we let folks go. Okay, well, I think we must have been extra informative today because I'm not seeing any questions. But thanks again to everyone who was able to make it today. We really appreciate your time. Thanks to the presenters from Heartland, from the Family Center, and we are excited to be able to share these great resources with you. So hope everyone has a great afternoon.